know children die daily. Like, I don't know children die like adults until I got to the emergency unit. You see, whatever I'm sharing with you in this my channel is mistakes mothers make that endangers the life of their children, that I have seen. This is not what I am told. This is what I have seen. This is what I have seen in reality. And sometimes some of us mothers, we do it and we go away with it. It doesn't mean we are smarter. It just meant you were a bit luckier then. It would happen to anybody. There was a day a woman came to the hospital with a child. I can remember vividly because this child, the story didn't end well. This child came very weak, and the mother didn't know the child was unconscious, but actually this child was unconscious. And we now asked the mother, why are you here? What is the problem? Like, the way she just came, dropped the baby on the couch. Nurse, my child is now feeling well. When I got to the table, when I got to the couch, when I touched this baby girl, this is 3 years old girl. This girl is already cold, but the girl is still breathing. When I checked the SpO2, I was having 45 for a breathing child, and this child is unconscious. Then the first thing that came to my mother was like, mother, what happened? He just became sick yesterday. And we're looking at this child is unconscious. SpO2 45. Okay. I checked sugar was low. Then the first thing that came to my mind, I opened the stomach, like I opened the tummy, because this thing is now like, it's common now. You will see babies with incision, and I have seen many. I wouldn't have made this video if this is not life-threatening. I have seen many. So the first thing I did again was I opened the stomach and I saw that there are fresh cuts in the abdomen. Okay, I didn't answer the mother again. I sent for my, or whatever we used to work. I didn't ask the mother question again. The first thing I did, I went straight to our pharmacy, got Nesaprom, connected oxygen for this child, and we started resuscitation. Because we know this woman is not telling us the truth. But first, let us stabilize this child, then we talk to this woman. See, for the fact that your child's stomach is swollen does not mean that because some of you just have this mindset that once the stomach is swollen, it means either the liver or the spleen is enlarged. That is one of it, but that is not all of it. Yes. And your child's stomach is swollen. Let me shock you. It can be because of malaria. Yes. It can be because of sickle cell disease. It can be because of bacterial infection. And it can be because of viral hepatitis. So, to go back to my story, this woman took, according to her, they told her that hospital will delay the treatment since the child's stomach is swollen. So she took this baby to a traditional child to, I don't know where. But she said she took the child to somewhere where they made this incision. Wait, let me just give you an instance. What if this is just viral hepatitis? Or this is just infectious bacteria? You now take this child to where they make incision. First, you have delayed early treatment, proper medical diagnosis that can help rescue your child on time. Then you now came when this man told you, madam, take your child to the hospital. When a native man or an herbalist refers you to a hospital, you know what that means. Very good. Then this woman now came. Okay, she now came. Instead of opening up, look at what happened. Look at my child. No. She said the child just became sick yesterday. And now decided to bring her to hospital today. Me, I was already like, I was mad. In my spirit, I was boiling. Because I know this story is not going to end well. And this child would have survived had it been the mother did the needful. So to cut the long story short, we went on resuscitating, giving oxygen, trying to correct the low sugar, antibiotics. We did all we can, did lab tests, and that was a restless night for me because I was on night duty. And finally, this child, we struggled with this child for at least 12 hours, and That was where the story ended. Then I looked at the mother. See, as a mother, some mothers did it with it. Like once your child's stomach is swollen, they will tell you they will make incision and this child will be fine. I've just given you 4 reasons why this child's stomach can be swollen. Even malaria can still do that. So please, seek medical help on time and save these children. I don't know, children used to die daily till I found myself in children emergency. And that is the least you can do for your child. Seek medical help on time. And what was this? Just because a child's stomach was swollen. This child was heavily infected. But you left this child where they will be cutting. Oh my God. And came when this child is already gasping. SPO 245. We can't even, the pulse was so faint. All the body were cold. This child is unconscious. Then you, the mother, you are relaxed to you. Because when I asked her, she said, I thought she was sleeping. The best you can do for your child is to seek early medical care. Join me next time as we talk about realities. What mothers do. To you, you are doing your best, but actually, you would have done better.